want to welcome Dr. Elaine Wang from Harvard Eye Associates. Thanks for joining us. We have a big topic today on glaucoma and some other stuff too.
Right. Thank you for having me here.
So just a little refresher in terms of what is basically, glaucoma is a leading cause of blindness for people over 60, right? So
right. That's exactly right. In the world, glaucoma is the leading cause of irreversible blindness in the world. And in the United States, it's the second cause just after macular degeneration. But the risk for people who are 60 years and older is 9 times higher compared to people who are younger. So it's definitely much increased. And glaucoma is irreversible, unlike cataract. When people have cataract, you hear from your families and friends, they get surgery and then they see a lot better.
I could see the next day. I walked out and it was like I was a new man, right?
That's exactly right. Unfortunately, glaucoma doesn't work quite like that. Glaucoma is something that causes permanent damage, and the damage is on the nerve that connects your eye to the brain. And everybody, when they hear the word glaucoma, they probably heard people talking about pressure in the eye being high, and that is the pressure in the eye that's causing the nerve damage.
Which I didn't know that high blood pressure and high blood pressure in the eye were two different things. I learned that recently.
That's exactly right. High blood pressure and high pressure inside the eye are two completely separate things. Even though in special cases, maybe it can affect the blood pressure can affect the eye pressure, but think of the eye pressure more like the pressure you feel if you push a balloon that's inflated. So it's unrelated to whatever's outside. It's whatever air you put inside the eye.
Don't do that to your eye to test that theory.
Yeah, exactly. Do not try that.
So people shouldn't associate, I don't have high blood pressure, so I don't need to worry about glaucoma, right?
You're absolutely right.
So what are some of the things that people can do in terms of early detection, and is there prevention? Can you stop it in its tracks?
Right. So I wish there's a way that people can detect glaucoma. Most of the time, like I highlighted on that slide, majority of people actually do not have any symptoms when they have glaucoma. They don't have pain, they don't have any irritation or redness. Some of the symptoms in severe stages people can tell is tunnel vision. So they actually still see 20/20 if they're looking at an eye chart in a doctor's office, but they're not seeing anything on the side.
The peripheral kind of goes away, that side eye.
That's exactly right. In very horrible cases, people can get T-boned in car accidents because they're actually not seeing big objects coming at them.
So if people are noticing that they're having to turn their head more to see things, is that kind of like, maybe I should go to a eye doctor, go see, or if there's, let's see on the slides here, you talked about there's that tunnel vision, there's maybe some blurry spots that are permanently blurry spots in that vision too?
That's right. It's usually not transient. If you blink your eye and the symptoms go away, that's completely different. But if they're persistent, you're noticing a gray patch or even a black patch in the periphery of your vision. In very rare cases, it could be kind of towards the middle of the vision. That's something that's really, really alarming, and you should go see a doctor to look at to have it looked at. But the highlight is most people do not have symptoms, and they should just be screened yearly to make sure they're ahead of the game.
Okay, what can be done? What can be done to slow it down? In what ways can there be any kind of treatment?
Right, so there are actually many options we do now to treat glaucoma. Traditionally, we always start with eye drops. You've heard if you have families and friends with glaucoma, they're using 1 drop, 2 drops, 3 drops, up to 5 drops a day throughout the day. And that's the old way of doing it. Nowadays, based on new clinical trials and technology, we actually push for having laser, a non-invasive laser that's done in a clinic prior to any surgical intervention. It's the least invasive intervention that we could do in the clinic for you. It's called the laser trabeculoplasty. It's actually been around for decades of time. And nowadays, it's just based on more research on it and long-term follow-up data. We actually recommend that being considered hand in hand with drops, sometimes even as the first option.
So what do the drops do? Do they lower the pressure in the eye?
That's exactly right. Drops are used in the eye to lower eye pressure. They do that through many different mechanisms that I wouldn't bore you with, but it's on a molecular level where it either helps the eye to drain fluid better or reduces the fluid production. And the laser does similar things. The people, when they think of laser, they immediately turn to LASIK or lasers that burn something, cut something. This is not what this laser do. The laser trabeculoplasty, or SLT, actually does not invade anything. It doesn't cut anything open, doesn't cause bleeding or inflammation. What it does is actually rejuvenizing the the system in the eye that's the plumbing system that gets rid of waste fluid to allow more efficient outflow from the inside of the eyeball to the outside and kind of deflate the balloon in a little bit to reduce pressure that way.
Now, previously to this treatment, there's also was glaucoma surgery that people had done, and what was that? What did that entail? Or is that still something that we were doing to this day?
Yeah, glaucoma surgery are still reserved for people who are more severe, and these are surgeries reserved for people who has gone through multiple drops trials and multiple lasers and still don't have their pressure improved, which
can
happen.
Kind of a last resort.
That's
then.
Exactly right. So we tend to do laser now much earlier in the treatment process.
All right, so let's get back to this laser, like you said, and there's a trial going on that you wanted to talk a little bit about with this technique.
Yeah, that's exactly right. We're actually very proud to be one of the 20 sites that's nationally involved in doing this. This is a National Eye Institute headed trial. So it's not one of those pharmaceutical commercial trials. This trial legitimately is initiated by a group of glaucoma doctors who are very, very interested in learning, since the laser works very well, can we do it in a more efficient and safer way? So the whole idea is, in the past, when we offered the laser, we do it once, and then if it works, great. But the effect of the laser do wear off over time. Then we offer it again as a repeat treatment, hopefully to enhance the treatment from the first time. But if the second time also wear off or doesn't work, at that time we would say, you're probably not a good candidate anymore. But nowadays, we like to see if we lower the initial treatment energy, but offer the laser repeatedly every year, regardless, whether that's going to be more of a long-lasting and safer way. So based on preliminary data, a whole lot more people who's treated with the low energy but annual repeat style actually maintain to be not having to use any eye drops in order to have their pressure still under very well control.
What do they think? I know it's a clinical trial, so they don't know yet, but what is the theory that they're working under in terms of the lower energy? Why would that make a difference in terms of higher energy, the lower energy? Is it less invasive or less impactful on the eye?
Yeah, so each time when less energy is delivered to the eye, the level of inflammation is triggered. There is some level of inflammation. The lower the energy, the lower inflammation you are doing it. But it's almost like, think of it as a facial treatment. If a lady is going to a spa, it works much better if you kind of do it regularly instead of do it once every 2 years, right? So you can see maintaining the effect is much better than doing extreme exfoliation every 2 years. So that's kind of the similar idea. If we keep it, and also another analogy would be taking your car for maintenance, right? If your car, you drive it and it broke down, it takes much more effort to restore it than taking it to maintenance every few months and make sure it's doing what it's supposed to do and safer that way.
So for this trial, who are you looking for in terms of candidates that would work for this trial that's going on?
Yeah, this is definitely a trial designed for adults, and we're specifically looking for a group of people who is newly diagnosed as glaucoma or high pressure in the eye, but not glaucoma yet. They're in the conversion process that needs treatment. And these patients cannot have previous treatment. So in other words, if they've been treated on drops or lasers before, unfortunately they won't qualify for this particular trial. But if you're one of those, your optometrist told you, hey, I think you may have glaucoma, then you might be a perfect candidate. We would invite these kind of patients to come in for us to screen you further and identify whether your suspicion is bad enough that we need actually to treat you to prevent you from converting to more severe glaucoma. And these patients, if they need treatment, this would be a perfect trial for them.
Now I want to be clear about this. In this trial, we're not talking about a cure, right? But this is a prevention. We're kicking the can down the road in terms of like keeping someone's eyesight intact as long as possible during these treatments.
That's exactly right. You got it 100% right. Glaucoma is not something we can eradicate per se. We cannot cure it. We maintain it by lowering the pressure. So the theory is the lower your pressure stays, the longer it stays low, the more vision we can preserve.
And so people shouldn't be calling you guys up. They need a referral on this, right?
That's
so
right.
It's either through, if you've diagnosed someone, they're at Harvard or at some other optometry center, then they're going to be able to maybe give a reference to you. So if people are considering that, they shouldn't be calling you guys.
That's right. We have internal optometrists that are happy to do the screening part, actually. So if you do call us, we can schedule an appointment to screen you and see if you are eligible for the trial. If you're designed if you decided that you are eligible for the trial, then you go through my clinic to do the whole trial evaluation.
Terrific. Well, like you said, people should be going in there anyway for their regular maintenance and making sure they're getting these checkouts, especially since this is something that, like you said, most people can't detect on their own. They can
detect, and the down the road, if you let it go, if you were to actually have glaucoma, is blindness. So we want to prevent that.
I get that. Well, Dr. Elaine Wang, Harvard Eye Associates, thank you so much for joining us.
Thank you for having me.
It's very interesting clinical trial.
Thank you.
Terrific. Yeah. All right, when we come back, we're going to be hearing from, through the magic of television, we're going to transform this studio into a concert hall, and we're going to hear from the traveling Wilbury Village folks. All right, we'll be right back.